Hello, welcome to UDN PEER's November Tell Me More lecture entitled We Are Family, where we are going to be providing strategies and resources to help family members living with an undiagnosed ultra rare patient. My name is Christine McGarvey. In addition to being the director of the Telling Me More lecture series, I am a UDN PEER member. I am also a UDN participant and a mother of a participant. I am joined here with my colleague, Jessica.
Hi, I'm Jessica Swanson. I am co-chair of the UDN PEER. I'm also a mother of a participant. My daughter started the UDN a couple of years ago, and she was able to get a diagnosis. And we're really excited to share the information today. I think it's going to be helpful for lots of people, family and caregivers.
And Jessica is going to be monitoring the question and answer. So if you have any questions, you can type it into the Q&A section. And at the end of the presentations, if we have time, we will go over the questions. We're going to start with our first speaker, which I am going to introduce. It's a pleasure of mine to introduce my husband, Todd McGarvey, and he's going to share his mental health story with living with an undiagnosed spouse and daughter.
Hello, and thanks. I just wanted to say thank you, and thank you for having me here. I'm looking forward to speaking to everyone today. And as Christine indicated, I'm her husband. Christine and I actually met back in 2006. At the time, we were both living in apartments outside of Philadelphia. She was a graduate student at the University of Pennsylvania at the time, and I was a lawyer, and we were both commuting into Philadelphia for her schooling and me for my job. And I noticed her one day. I hadn't noticed her before, and we struck up a conversation, and we got to know each other. We were dating, and about 6 months later, we were engaged. So it was that was kind of the start of my relationship with Christine, and it was an exciting time for me. I think for her too. We had dreams of kind of having a family, but I'd say within the first within the first 6 months to a year of knowing Christine, she started to have I started to see her having problems with gastrointestinal issues, with difficulty digesting food. When we first started dating, we would go out and eat a lot and go to places and be able to have dinners out, but that kind of changed, and she started to have issues with digestion and problems with her bladder and bowel. And at the time, she was still in school. She was at Penn and then at Drexel, and it was I didn't really, I guess in the beginning, I didn't really think that much of it. I didn't think it was a huge issue. But we both wanted to have a family. We wanted to have a child, and Christine's issues with her digestion and her health problems kind of became more to the forefront when she became pregnant with our daughter Bridget. It was kind of a time where I was expecting it to be a joyful time and a happy time, but there was a lot of challenges because Christine, because of her issues with her GI issues, she wasn't able to gain weight. And towards the end of her pregnancy, our daughter Bridget, she stopped growing, and it was kind of a stressful time, and certainly not what I was expecting to have happen to my young wife and daughter. Christine's 7 years younger than me, so I wasn't expecting her to have these kind of issues. But luckily, Bridget was born, and she was healthy. She was small. She was a little baby. She was small, but after that, things kind of got worse with Christine and her health. Before she had gotten pregnant, we had talked about her. She was teaching at the time, and kind of I had expectations that that she would be able to go back to work after Bridget was born. That didn't happen. because her symptoms became worse. Her GI symptoms became worse. So I was kind of thrown into the position of being the provider for both her and now a new family member. And there was certainly a lot of conflict in that, and we didn't know what was going on. We had no idea what was causing our problems, and we had no idea what was leading to these GI issues. And eventually, Bridget, our daughter, started to have these same types of issues. She had problems with incontinence and digestive issues, and she was she wasn't progressing as a child should with potty training. So we were very certainly very concerned about that, and I kind of was in denial. I think I didn't want it to be true that my daughter was having these same problems that Christine was having. And we had a lot of conflict at the time, because Christine was recognizing that Bridget was having kind of the same issues that she experienced, and I didn't want that to be the case. And so not only are we going from being a 2-income family to a 1-income family, but there's this conflict going on between Christine and I about Bridget's health care and how we should handle it. And and I think this is probably about, Bridget was probably about 3 years old when this happened. So it was devastating for me, and it took a lot of there was certainly a lot of conflict in our family between Christine and I, about not only about her own health care, but also Bridget's health care. And things started to, while all this was happening, Christine actually, her condition started to deteriorate in other ways. When Bridget was young, when she was a baby, she's 9 now, but when she was about 3 or 4, and we started to realize that she wasn't developing as she should be. Christine's condition started to get worse. She was needing oxygen, and eventually she was put on hospice, which was a lot for me to handle, because I was worried about whether she was still going to be here, whether her condition was so bad that I would be a single father. I had even purchased books, or looked about purchasing books. Didn't actually buy them, but I was looking at books about what it meant to be a single father. And this is this was not what I was expecting to be walking into when I married my young wife, and we've to be putting a 37-year-old on hospice is scary, and certainly not something I expected. And it was grief. I think it was a grief process, a process of loss for me of the life I thought I was going to have, was expecting to have, and the one I had. But Christine and I, and we've worked through kind of her health issues and Bridget's health issues by laughing a lot. We keep things light. We joke about things. We joke kind of, she's still obviously she's still undiagnosed. So is Bridget. They still have these problems that we deal with every day. And we still don't know why, but we've kind of learned to deal with it by laughing, and by our faith. We're a Catholic family. We go to church, and we do that together every week, and that kind of keeps us together. So that's kind of my story, and how we as a family with 2 people undiagnosed have learned to deal with our issues, and to be in a place where we feel good about, good and hopeful about our future. Thank you.
Thank you so much, Todd, for being vulnerable. I know the story, but it was still difficult to hear someone else share the story, but thank you for being honest and vulnerable. Our next speaker is Catherine Brockman. She is a licensed clinical social worker and founder of Totem Counseling and Consulting Services. She has 13 years of experience supporting individuals in identifying and communicating their needs. She is passionate about supporting clients to live whole lives full of happiness and emotional healthiness. Catherine focuses on exploring the mind, body, and spirit to aid in creating a unified whole that each client is excited and proud to be. Catherine is an expert in dealing with trauma and grief and establishing healthy relationships. She guides clients in understanding and expressing emotions, coping with loss, developing healthy boundaries, building communication skills, and creating healthy, supportive relationships. She will be discussing resources and strategies for partners, parents, and extended family members living with an undiagnosed ultra-rare patient.
Thank you, Christine. Thank you all for having me today. I'm excited to share some information and just support the work of the programs and all of you going through this. So today, I just really want to look at exploring and understanding grief and boundaries and communication so we can develop a way to care for ourselves while we're caring for our loved ones. So, this is grief. You don't get to have a normal life. You can't have that normal life. It's a trauma that you and your loved ones are experiencing. And grief requires us to adjust to so many changes. It's painful, it's unfair, it's a loss of what could have been, what should have been, and what we expected. Grief is complicated, it's subjective. It can be different for different people and at different times throughout the entire experience. I really look at grief as being two parts. We grieve the person or thing we're losing. And then the secondary part is all of those hopes and expectations and dreams that were tied up in that. So what I thought my life would look like, what I thought being married, being a parent, being a friend would look like. It's all shifting and changing because of this trauma that you're experiencing as a whole. It's about really understanding that caring for you means that you can then care for them. So we used to talk about grief kind of that you feel, and we've really realized that that's a very unhelpful way to look at it. Grief is much more like a crater. It absolutely blows up our life. It changes everything, and it creates this deep, dark space. And instead of trying to put things in to fill that, it's what we're doing to expand our life around so that the whole becomes smaller. It's always going to be there. It's always going to be a bit raw and a bit crumbly, but we can learn to incorporate beauty and wonder and growth and love around that. So care has to start with you. You can't take care of anyone else until you take care of yourself. And oftentimes it's the first thing we kind of give up. We're willing to say that we can give up those things in order to care for someone else and that be a sense of love, but it really needs to start with taking care of ourselves. So self-care are the things that we do to protect and promote our health in all of our different aspects. So we have to look at what are we doing for our physical health, our mental health, our emotional health, things that renew us. It can be taking time off. It can be having a cup of coffee. It might be asking for a hug, taking time to sleep. It's all of those aspects kind of coming together. So it's not an excuse to do whatever you want. It's not a selfish thing or self-indulgent. It's really an essential part of our health. And if we don't take care of ourselves, we'll drain very quickly and be unable to care for others and the people in our life that we care about. Instead of giving it up as the first thing, we should really be protecting it more than anything else. So the first part is our basic needs. That's where self-care always has to start. Have I eaten today? Have I had something to drink? Have I had enough sleep? Do I need to put on a sweater or take off a pair of socks, change the temperature in the room? Am I in any kind of physical pain? The brain and body will go here first. And once all of these needs are met, we can look to our other needs. So when we're thinking about giving care and it's asked of us, we have to ask ourselves 2 questions. And that first question is, what do I have to give? I have to kind of take a check. What time do I have available? What resources do I have available? Emotionally, am I in a space that I can do this? Mentally, am I in a space that I can give those things? So if we check in on that first, we'll be able to identify what we actually have available to give to someone else. And then I like to tell people that the second question is actually more important than the first question. And that second question is, what do I want to give? What do I actively feel like I can and want to do? And not wanting to do something is a perfectly fair reason not to. And in these circumstances, there's going to be many times where it's, I don't want to do this. It's unfair. It's hard. It's difficult. We have to be thinking about that question. So it's really just a reminder that you matter and that taking care of yourself isn't just me first and it's only about me. It means I do myself first so that I can take care of you once I've done that. So it's really about showing compassion for you and for your loved one. It's really important that we do show our emotions. Everybody's feeling the range of them. You're angry, you're sad, you're scared. We can't just be happy. That doesn't help us, and it certainly doesn't help our loved one. And us sharing those emotions actually often lets the other person also recognize and share their own. They're able to lean in and say, yes, I also feel that. I might be trying to be strong, but maybe sometimes I need more than I, have at that place to be able to acknowledge this hurts. I'm scared about it. I'm sad about it. It's a way we kind of confirm and affirm each other. And the biggest part of that is that sometimes there is nothing that we can say or do. It's just about being present and being authentic. And so in showing that compassion for all of the emotions, we let each other have that really honest space. Humor, especially, is a very important part of it. Oftentimes we find with traumatic and grief spaces, if we don't laugh, we're going to cry. And many of us would rather laugh instead. And so finding those things that we can make jokes about and make it a little bit lighter can help us move through it. Grief is a deep and painful thing. And a way of expanding around that is finding the spaces of humor. It's okay to find excitement and joy, and that doesn't take away from things. Again, humor is that way that we expand ourselves around that grief. So it's really about finding how we support. So educating yourself about, the diseases that are being researched and tested, and learning about your loved one's needs and wants, really understanding what's important to them. What do they find value in? What about emotions and communication? And then it goes both ways. We're doing this for our loved ones, and they're also doing it for us. What are you feeling? What do you need? What do you find value and importance about? Making sure that that conversation goes both ways, because we're not always on the same page. One of them might be angry and you might be feeling sad at the moment. And being able to share that difference is very helpful and important. Often our job as supporters is really just to hold space and time. We, as human beings, want to be seen and heard. It lets us know that we're important and we matter. And sometimes that's the most important part, just being there and being present for however it ranges. We might go from I'm angry to I'm sad to I'm scared to I'm laughing about it in the course of 10 minutes. And having somebody who can just allow us to have those emotions is such an important thing. So it really is about building that emotional intelligence. Our emotions system, they kind of go off to tell us what we're in need of. And then we engage in relationships to get those needs met. What often happens is we're not talking about the needs. We talk about the emotions. And that keeps us often in this very small, narrow, subjective place. And we want to really expand that from I'm feeling sad to yes, I'm feeling sad because I need comfort, because I need an answer. It lets us move in to a deeper and more connected space. One way we do that is what's called nonviolent communication. So nonviolent communication runs on that premise that we have emotions as an alert to our needs, and we need to speak about our needs. So this is kind of the what I call prescription that nonviolent communication uses in order to do that. So in nonviolent communication, the examples are often around food. If you walk past a bakery and you can smell bacon sizzling and coffee brewing and pastries, you may experience hunger. Hunger is not your need, it's your feeling. It's the alert system saying, pay attention, you need nourishment, do something about it. Oftentimes we then have that conversation, oh, I'm feeling really hungry. And somebody else could walk past the bakery, not feel hungry, be sick, not like that food. And then we're in this tension space of I'm hungry, you're not hungry. What do I do about that? Why aren't you hungry? You should be. Don't you like that food? Where if we would step back and move into the need space, we could say, I'm feeling really hungry because I need nourishment. Can you? And it moves us into solutions. Can you grab me something? Can you make me a meal? Can you DoorDash me food? Can I stop and grab something? Spans our life again into spaces instead of keeping us in those narrowed places. It really goes into boundaries. And this is, I think, very important for both caregivers and individuals who are dealing with an undiagnosed rare disease. Boundaries there are terms of engagement. They're the limits of what we're willing to accept and what we can handle. And we use them to protect ourselves. They're extremely essential. They're what makes the world work. If you look at any sector of life, it has boundaries. It has rules of how we engage, how we communicate, what's allowed, what's not allowed. We need them with ourselves and then with others. It's a way of creating protection and space for ourselves. Oftentimes when we draw boundaries, people throw tantrums like a child who isn't getting what they want. And often that is where we pull back and we'll change our boundary, when we need to remember that it's actually a sign that that's where the boundary is most needed. We're not responsible for another's emotional reaction to us drawing a line and saying, I can only give this much. I need to take space. It's okay to draw that and then take a step away from it. It comes into setting our expectations. Our life is different. Our life is limited. And we have to be able to share and express that. And boundaries are a way that we communicate our needs. Giving ourselves a break. I can talk about it for 15 minutes. I can't talk about it. I need 15 minutes to process for myself. Taking a bathroom break, getting a drink of water, taking a walk or a day off. They're very important. And this especially goes into birthdays and holidays and having to set those limits. You know, it's about really saying to someone, this is what is ideal for me. And this is also my least acceptable way. We're really looking at what we have to change. And so it might have to be saying to someone, I understand that this is different and you're going to have a reaction to that, but I still have to, not come to Christmas for myself. I still have to leave, in a half an hour. There's still the things that I have to do. So we're really looking at those changes and saying, why are they changing? What is important about this that I need to hold on to? And what do I need to give up for me to be healthy? So just thinking about resources for yourself, therapy as a caregiver is a very helpful thing. It gives you a place to talk to someone who is outside of things. You can express your emotions and your concerns, someone who isn't experiencing what you're going through, using the hotlines to talk when things are hard, because they're available 24/7. Looking for support groups, even outside of the normal, maybe in meetups or Facebook, that are about doing things you enjoy. And then there are a couple books that I have found really helpful that are listed there, and I can make sure links are available to others. So really support yourself too, so you can support your loved ones. Thank you.
Thank you so much, Catherine. I really like the analogy of grief as a crater. That was very helpful. Our third speaker is Alex Lowy. She is a clinical mental health counselor and an associate faculty member at Post University in Waterbury, Connecticut. She is also a UDN participant at the Harvard clinical site, where she has received the partial diagnosis of a rare metabolic disease. Alex's educational background is in clinical and health psychology. Most of her career has been centered on the fields of trauma, resilience, and neurorehabilitation. Her special interest lies in the advocacy of rare and undiagnosed disease patients and the role of mental health throughout the diagnostic odyssey. She will be discussing resources and strategies for siblings living with an undiagnosed ultra-rare patient.
Thank you, Christine, and thank you, everybody, for having me. And today I would like to talk about the impact a child's rare disease has on his or her healthy siblings. And living with a rare disease is really difficult, and it comes with a lot of worries, fears, and challenges. And since many rare diseases are actually diagnosed during childhood, a rare disease diagnosis does not only affect the individual, but the entire family. So rare families face, like I said, many common challenges. And the most prominent of these challenges are medical challenges. So many rare diseases take a long time to diagnose correctly, leading to what's known as a diagnostic odyssey, a really lengthy period that's filled with tests and misdiagnoses and lots of uncertainties. And many of us are unfortunately all too familiar with those. Some rare diseases may have limited or no specific treatment options available, and that often leads to frustrations and feelings of helplessness. Families often find themselves having to become experts in their child's condition and advocate for their medical needs. Many rare diseases require care from specialized doctors, which might not be locally available. And finding relevant resources, support groups, or information about the rare disease can be really difficult, causing additional challenges for families. Then there are financial challenges. Treatments, hospitalizations, medications, and specialist visits can quickly accumulate, placing a financial strain on families. And often one parent might have to reduce their working hours or leave their job entirely to care for the affected child. There are oftentimes additional costs, which might include travel for specialist visits, home modifications, or specialized equipment. Due to the rarity of the condition, there might be misconceptions or lack of knowledge among the public and even among some of the healthcare providers. Families might feel isolated from their peers and communities due to the unique challenges that they face. Explaining the condition to friends, extended families, family, teachers, and others can be really tough and often is a thing we have to do over and over again. The rare child may have special education needs and require individualized education plans or additional support in school. And depending on the disease, there may be associated developmental delays that pose additional challenges in traditional learning environments. There's grief and acceptance. Parents and siblings may go through stages of grief, and while adjusting to the diagnosis and what it means for their family. Continuous caregiving and uncertainty about the child's future can lead to chronic stress. Depression, anxiety, and other mental health issues can also arise and be exacerbated in family members. And since the stress, of course, can impact the whole family, I specifically would like to now focus on the impact on the healthy siblings. And the siblings of children with chronic health conditions are at an increased risk of psychological problems. And the risk may be increased when the chronic disorder is rare. So siblings may sometimes feel guilty for not being healthy when their brother or sister is sick and ask themselves, why not me? Why am I okay? Their concerns about their siblings' health, fear of loss, or worries about the future can lead to additional anxiety. And witnessing a sibling suffering or facing the loss of a sibling can cause profound sadness and grief. On the flip side, there might be jealousy or resentment, for example, for the attention the sick child receives, and the sibling might feel simply overlooked. Depending on their age, the siblings may struggle to understand the rare disease and its implications, which can lead to confusion and frustration. And they may also have difficulties expressing their emotions. Looking at the social impact, healthy siblings may feel isolated from their peers due to the unique challenges they face at home. And they may encounter misunderstanding or stigma from friends or acquaintances who do not understand or comprehend the situation. Caring responsibilities or the need to be available for the sick siblings' medical appointments may limit their participation in social activities. Healthy siblings may mature faster than their peers as they take on additional responsibilities and cope with challenging circumstances. Some healthy siblings assume caregiving responsibilities in helping with daily activities or providing emotional support to their ill sibling. In an attempt to gain recognition and approval, some may excel academically, in sports, or in other areas. Conversely, some siblings may regress in their development, seeking attention and care from their parents like a younger child would. So how can we as parents and caregivers support the siblings? Research by Hochland concludes that interventions should target siblings' mental health, communication and relationships with their parents, and social support. So one of the really important areas of support is open communication. It is important to maintain this open communication and explain the sibling's illness in an age-appropriate way to ensure that the healthy sibling understands without being frightened. Let them know that it's okay to ask questions and express their feelings. Spend one-on-one time with the healthy sibling, engaging in activities that they love, and celebrate their milestones, no matter how small, to ensure they do not feel overlooked. Allow them to express their feelings, even if they're negative or difficult to hear, and encourage using creative outlets, for instance, writing, drawing, or other creative means to express feelings, maybe dance or theaters. And depending on the child's age, one really helpful way is drawings. And there are these little mandalas, I believe they're called, that really help the child sort of center and focus by drawing these little shapes. Ensure the educators are aware of the family situation to provide necessary support or understanding, and recognize that siblings might sometimes struggle with schoolwork due to family stresses, and provide help when needed. As much as possible, try to keep routines in place and offer a sense of normalcy, and ensure that boundaries and rules remain consistent for all children, providing a sense of fairness. Encourage them to spend time with friends and continue with their usual social activities. Consider finding support groups for siblings of chronically ill children, providing them with a peer environment where they can share experiences. If the sibling shows signs of significant distress, oops, I think my slides just moved on me, I apologize. If the sibling shows signs of significant distress, depression, or anxiety, consider counseling or therapy. Family therapy is a good addition to individual counseling, since it can help address family dynamics and provide coping strategies. Provide age-appropriate books or resources about the disease to the sibling to help them better understand the disease. Depending on their age and comfort level, let them assist in the care of the sick sibling, fostering understanding and closeness. Again, in age-appropriate ways, discuss potential future scenarios related to the disease, and ensure they know they'll have support even in challenging times. Validate the feelings of the siblings. So let the sibling know that their feelings, whatever they may be, are valid, and reassure them continuously to make sure that they feel loved, and that you have pride in them. And sometimes we all just simply need a break. Arrange for short family breaks or vacations, providing a change of environment and relaxation for the sibling, and allow the healthy sibling some personal time away, be it with friends, extended family, just so they can recharge. Next, I'm listing several sources that might be helpful. There are organizations like the Sibling Support Project, Easter Seals, the National Organization for Rare Disorders, but also local hospitals and therapy centers can be really good resources, and local organizations. Depending on the age, books can be really good to help the child understand maybe the sibling's illness, and also educational resources, depending on the age. Local community centers are good resources, and also looking at maybe the special education departments and school counselors. Counseling and therapy again, if the child starts to experience a lot of anxiety, feelings of depression, then those would be indicated. And then camps and retreats that are focused on children who have disabilities and on their siblings. And then depending on the sibling's age, some online forums, communities, resources might be helpful, as well as some social media groups, so Facebook or Twitter. And I listed a few more resources there. there is some further reading, and if anybody's interested, I will gladly forward those. Some very helpful books, I think. And I wanted to end this presentation on a positive note. So while families and siblings of children with rare diseases can experience a lot of negative emotions, a lot of anxiety, there can also be positive impacts and some growth. So interacting daily with a sibling who has special needs or health issues can nurture a profound sense of empathy, and siblings often become more attuned to the emotions and needs of others around them, not just within the family, but in broader contexts as well. They ensure exposure to complex health issues at a young age can accelerate maturity. These siblings often learn early on about responsibility, patience, and understanding. Engaging with diverse medical professionals, support groups, and other families in similar situations can enhance siblings' social skills, making them more understanding and effective communicators. Siblings can often become well-informed about the rare disease, leading to a broader understanding of health, biology, and medicine. This knowledge can be an asset in academic and real-life situations. Depending on the needs of the child with the rare disease, siblings might acquire specific skills such as caregiving techniques, first aid procedures, or even communication strategies like sign language. Exposure to the medical world, therapies, or advocacy might inspire siblings to pursue careers in related fields such as medicine, physiotherapy, counseling. In advocacy, standing up for the sibling in public situations or even explaining the condition to peers can develop leadership qualities in siblings. Living with a sibling with a rare disease can instill a sense of understanding and appreciation for diversity and the importance of inclusivity in society. Dealing with adversities related to their siblings' health and condition teaches siblings resilience and adaptability, traits that can be valuable in other life situations. And finally, overcoming challenges together can foster tight-knit family bonds. Families often develop a shared understanding and closeness through their unique experiences. And then I just listed a few references.
Thank you so much.
Thank you.
I really appreciate it. I definitely, with my daughter, have noticed the positive impact of developing a sense of empathy. I remember when my daughter was 4 in preschool, a child was crying, and she walked up to him, gave him a tissue and a hug. And I remember her teacher telling me about that and how she was shocked because normally at that age, they're very self-focused. So there's definitely positives that come along. So,
yeah. Yes.
So now I want to remind you that if you have any questions, you can type them in the Q&A. And I also want to make an announcement for a research study. So the MGH, Institute of Health Professions, invites you to take part in a research study that seeks to explore the potential benefits of a resource guide for caregivers of children with rare conditions. The study will require participation in 2 10-minute surveys and a 10-minute review of the resource guide over the course of 3 weeks. Those who complete both surveys can enter a raffle for one of 10 $25 Amazon gift cards. If you have any questions, please reach out to Elizabeth San Gregory at ESANGIORGI@mghihp.edu. Also, if you want a copy of the slides or more information about this research study, you can contact me at Christine at UDNF So, Jessica, do you have any questions?
We did not get any questions in the chat, but if anyone has any questions now, feel free to put them in, and we'll be happy to answer them.
I can start off with a question for Catherine. So oftentimes, like with a spouse of someone who is sick, they often don't feel comfortable sharing their feelings with the spouse that's sick. Do you have any advice? Is that okay? You know, how should that situation be handled?
It's definitely hard. I think a lot of times we look at it and think, if I share my space, I'm taking away from yours, or you're not going to agree in that space. But our emotions need expression. They need to come out. The more we hold them in, the more we push it down, and it lashes out. It kind of dumps out. So finding little ways to say, like, yes, I'm feeling that too, or, you know, I'm also feeling this. It's just a statement of kind of my subjective space, not you have to feel this way too. So sharing with your partner is important, or at least having a space where you are sharing that with someone, and recognizing, like, we're in this together. You know, we can feel differently about it, but it's kind of putting us in a place where we can say, yes, we both have feelings about it. What do then we need to support each other through it?
Thank you. Alex, I have a question for you too. Many you know, siblings of undiagnosed patients have actually unfortunately lost their sibling. Do you have any specific advice for handling that kind of situation with a child who has lost their brother or sister to an undiagnosed disease?
Yeah, that's really difficult. So that's the extreme end of it. I really think that therapy is indicated in that case. And like Catherine said, the sharing of feelings within the family. So it's okay not to be okay. And that we as parents don't have to pretend that everything is fine. I think that's quite important, depending on the sibling, on the child's age, always. Yeah, encourage as a parent the child to share their feelings, and validate them, be present for the child, and also be non-judgmental, not say, oh my goodness, now we have to be happy, and, you know, in a sense of getting over it. But I do think therapy would be indicated.
Thank you so much.
All right,
Jessica,
we did have a question. Yeah. And this is for Catherine. Do you happen to know of any providers of counseling services who are nationally available by telemedicine or with a specific interest in working with families impacted by rare disease? The question was, we often have families that are looking for those resources specifically.
Not off the top of my head. A lot of insurance companies are now providing telemed systems. So like Teladoc, telehealth, and MedJoy. So looking for a provider who has trauma background and grief background would be probably some of your best spaces for that. And I can look through and see, and certainly send any that I come across to people.
I also think NORD may have some mental health resources, so I would check out their website.
And if I quickly might chime in, Global Genes as well. They have a list of mental health resources on their website now as well.
Thank you so much. I appreciate that. if anyone has any other questions they want to put in the chat, this would be a good time to do it. We don't have too much time left, but we do have time for a few more questions.
Someone asked, will there be a copy of or a transcript of this? Yes, it's being recorded, so it will go up on YouTube. And also, like I said, if you want a copy of the slides, you can email me at christine@udnf.org and I could provide you a copy of that.
Oh, it looks like there is also a suggestion for giveanhour.org/rare caregivers. 11/27. I'm not sure what that means. Oh, they have a support group on November. The next one is on 11/27. So if you can see in the Q&A, there's the link to that website. Also, there was a comment, thanks to Todd and Christine. It's courageous for you to share your story. Thank you so much. Thank you for the presenters. This was a wonderful presentation. And I have had the privilege of meeting Christine and Todd in person, and they are like exemplars of what courageous is. And I'm so happy I get to work with Christine and I get to see Todd too at some of these events as well. But yes, the story it's important. I know it's specific to you guys, but it's relevant to so many. So thank you so much again, for sharing that with us.
Is there any other questions? I can ask another question if there's not. Alex, what tips do you have for helping the healthy sibling really cope with some of the uncertainty of living with someone who has an undiagnosed disease? Like, for example, kid was going to go to their friend's birthday party and now the sister or brother is in the hospital. Like, what strategies do you have that could maybe help maintain the sense of normalcy for the child?
That's a great question. And I think having a support group and as parents not shying away from asking for help, if there's family, if there are friends, to make sure that the healthy sibling can attend a birthday party, or that there is sort of a backup if the unexpected happens, which tends to happen quite frequently with undiagnosed disease patients, and then always trying to encourage the sibling to share their feelings and share their frustrations. But yeah, try to have a support group for those times when things just don't go as planned.
I guess I was thinking of another follow-up question to that. How can you help the sibling basically talk to their friends about, like, how can you model that communication? Because, that's their peer group, and I'm sure it would be helpful for the sibling to express their feelings to their friends. But how can you help the child communicate that to their friends?
That's a really good question. I think it depends on the age again. So teenagers obviously understand the disease itself much better and can explain it. And when the children are younger, keep it sort of simple. Just say, my brother's sister is ill, where mom and dad, the doctors are taking care of him or her. And maybe use some of the books that I listed, and have them as an example to show them, sort of a sample situation.
Yeah, I remember when my daughter was young, someone made a book said my mom has gastroparesis. And so when my daughter was young, I used that to help her be able to explain to her friends. So
yeah, and that's a great idea. And a lot of times it's repetitive. I'm a rare disease patient or partially diagnosed patient myself, and even with my own adult family members, I have to explain things again and again, that I cannot participate in this family gathering. It's too hot outside or things like that. And I think it's very difficult, even for adults, to understand the limitations. So I find that keeping it really simple, even with adults, and just say it's going to make me feel really ill. And that probably helps children as well. Just keep it very basic. I would like to join, or my sibling would like to, but he's unwell. The doctors are trying to help him, her get better.
That's great. We did have a couple more questions and not much time. So I'm going to try to combine two of the questions into one. For Alex, this is for both. If a sibling is born into a family where the older child has an undiagnosed disease, how does the sibling grow up only knowing that? What can the impact be? And with that, should they go to doctor's office appointments with that child?
Oops. That's another great question. So if the ill child is older, it's the younger ones sort of don't know any better, or they don't know any different. And so from what I've observed, it's a bit more normal for them to deal with an ill child. Go into the doctor's office. Again, I think it depends on the age. If they're really little, they may not see the severity. And it's just normal, right? This is a normal thing we do. We go to the playground, we go to the doctor's office. And also it always, as a parent, we have to kind of take the child's personality into consideration. So some children might be much more sensitive than others. So if a child takes things to heart, I would probably not take them to the doctor's office, because that can be intimidating. So it really depends on the character, the personality of the child, which as parents we're very good at gauging.
Love that. And just my 2 cents. So I have that exact situation where the older sibling has the rare disease, and he just went in the pack and went with us to every appointment. And I can't say for everyone, but for him, it was like probably the best thing that ever happened to him. He doesn't really know, he didn't know differences. In school, I get reports that he's very kind to, the kiddos that need extra help. So that's one data point for you. So it seems, and we just drag him along and he doesn't know any different. One final question, hopefully we'll have enough time to answer, but are there any best resources for parents with children of rare diseases that have been able to share their child's health data to advance and promote research to help other children and families that might be affected? I don't know if either of you guys have the answer to that. I think no, but maybe someone else has a better resource, hopefully.
I can look it up and get back to you with that information.
All right, that sounds good. And there's another question. I think we have time to squeeze it in. As a rare sibling gets older, a young adult, he or she may not want to share medical issues as much with the siblings. Are there tips to help this transition? We might have to get back to you on that. And we only have a minute left, and I think it cuts us off, Christine, if I'm right on that. So I don't know if you want to do any closing remarks.
Well, I just wanted to thank everyone for attending, and especially to Catherine and Alex and my husband for speaking today and sharing all this helpful information for undiagnosed patients and family members.
Thank you for having us.
Yes, thanks for having us. Thank you.
Bye. Thank you.